And we'll end with a clinical perspective from Dr. Andrew Varga, who's an associate professor in the Integrative Sleep Center in the Department of Medicine at the Icahn School of Medicine at Mount Sinai.
Yeah, so thank you very much for the invitation to be here. I'm Andrew Varga. I'm a sleep neurologist and neuroscientist at Mount Sinai in New York. By way of disclosure, I have served as a consultant previously for Merck, Eisai, and Jazz Pharmaceuticals. But today, my primary disclosure has to do with the fact that I'm serving here at the invitation of the American Academy of Sleep Medicine. And I should just make the disclaimer that the opinions that I'm expressing are my own opinions and not necessarily the opinions of the American Academy, although I do think they align quite well. So as you might imagine, the American Academy of Sleep Medicine cares very deeply about the sleep and circadian health of all Americans. And they invest a lot of resources into advocacy, education, and research into sleep and circadian disorders. So when I think about trying to kind of synthesize and summarize, what we've experienced over the last 2 days, I'm thinking about it through this lens of sleep disorders and as a sleep clinician. And I think we can chunk things into different kind of buckets. So the first bucket is, or just first observation, right, is the fact that sleep disorders are fairly heterogeneous. And you have some sleep disorders like things like REM behavior disorder or idiopathic hypersomnia, for which comparatively little is known about the underlying pathophysiology. And there are also very limited treatment options for those sleep disorders. And the treatment options are predominantly focused on symptomatology and not on the underlying pathophysiology itself. And so when I think about those sleep disorders, some of the talks that came to mind from this workshop are, the sort of the genes first approach and the combination of genes and environment that people like, Louis Potasek and He Fu talked about yesterday, and these 4 genetic screens that would be potentially very useful. I also think a little bit about, some of the novel potential interventions that can be done for these disorders, and comes to mind, Luis de la Sea's talk on, like I said, novel use of ultrasound in some of these sleep disorders. So that's sort of one bucket. The next bucket is things that are much more common, right? Things like sleep apnea and insomnia, which are very, very common and for which we actually do have treatments that work. But there's a number of factors that actually prevent the full effective treatment of even these really common sleep disorders. So one thing I'll say is that even though these are very common, I still think that they're probably underdiagnosed in America. And we really need to focus a lot more on sort of awareness and advocacy for these sleep disorders. And I really liked what Nate Watson said yesterday about bringing sleep education even into the elementary schools, right? I mean, I think this is something that would be very beneficial for the overall sleep health of Americans. And then other barriers to the treatment of some of these disorders includes actually getting at the diagnosis of these disorders. And we talked a lot about nearables and wearables that may be influencing the ways in which we diagnose sleep disorders. And so that's, like I said, another area. And then, finally, like I said, although we do have treatments for some of these things, right, treatment adherence is definitely a significant problem. And it's a more significant problem in some cases for disadvantaged populations, the way that Dana Johnson brought up yesterday. And then the other sort of big theme that I'm taking away from this workshop is what is probably the bidirectional relationship between sleep disorders and neurological and psychiatric disorders. And although sleep, I think touches on a lot of organs, Alan Hobson famously wrote that sleep is of the brain, by the brain, and for the brain. And so it stands to reason that sleep disorders may disproportionately affect neurological and psychiatric disorders. And I think what I sort of took away from this workshop, right, was that, a lot of sleep disorders, a lot of neurological and psychiatric disorders have in and of themselves sleep phenotypes within them, and it's an onus on us to identify what those phenotypes are and try to understand the best way we can address those phenotypes to improve the health of people with neurological and psychiatric disorders. But there's also this very interesting way of thinking about sleep and circadian disorders as influencing neurological and psychiatric disorders in a variety of ways, including, I would say, first of all, risk. Right? So, for example, is something like sleep apnea a risk for having a stroke or a risk for developing Alzheimer's disease? Does having a sleep or circadian disorder influence the trajectory of the disorder, especially for long-term neurological and psychiatric diseases like neurological or neurodegenerative diseases or things like multiple sclerosis, right? So can it affect the trajectory? And then finally, does having a sleep or circadian rhythm disorder end up impacting either the degree of or rapidity of response to treatment to neurological or psychiatric disorders? So I think these are all, like I said, themes that I sort of took away from this workshop, and hopefully it's fodder for discussion. So thank you.